We would like to begin by acknowledging that we are in Mi'kma'ki, the traditional and unceded territory of the Mi'kmaq people. We are all treaty people who benefit greatly from the shared resources of this land covered by the treaties of peace and friendship. I would also like to address just a few housekeeping items before we begin the presentation. This presentation will be recorded and available to view after the session. We will put it up on our website likely in the next week or so. We also ask that you mute your mics and keep your cameras turned off during the presentation. And lastly, if you do have questions during the presentation, please put them in the chat box. My colleague Drew will be monitoring the chat and holding all questions until the end. I would also like to provide a very brief summary of Child Safety Link. Child Safety Link is an injury prevention program at IWK Health dedicated to reducing the incidence and severity of unintentional injury to children and youth in Atlantic Canada. Child Safety Link is committed to working with community organizations, governments, and other partners to ensure children are as safe as necessary at home, on the road, and at play. Our at-home work includes poisoning and falls prevention. Our on-the-road work includes child passenger safety and pedestrian safety, and our at-play work includes helmet safety, concussion prevention, and ATV safety. I'd also like to note that November is Falls Prevention Month. I would now like to introduce our presenter for today, Dr. Barbara Morrongiello. Dr. Morrongiello is a professor of psychology at the University of Guelph, director of the Child Development Research Unit, fellow of the Royal Society of Canada and the Canadian Academy of Health Sciences, and recipient of the Order of Ontario. Today she'll be presenting on understanding and promoting caregivers' home safety practices. I will turn my camera off and hand it over to you.
Great. Thank you so much. I hope everyone can hear me. I'm going to be talking about understanding and promoting caregivers' home safety practices today. I'm happy to share information that we've accumulated, knowledge we have, and happy to entertain questions at the end for sure. Next slide. My plan for this talk is I'm going to provide a brief overview of what we know about parent-related factors that influence young children's risk of injury in the home. Then I'm going to discuss ways that you might promote parents' home safety practices, trying to convince them to do a little bit more than they are. And I want to just emphasize that I am really focusing on research with young children under 6 years of age, because most of their injuries occur in the home. So the caregivers' safety practices are really key, and that's why I'm focusing on that. Next slide. Okay, to a 2-year-old, there are 4 toys in this picture, and I love to start with this picture because I want to be sure that everyone has seen that there are 4 toys. You know, the outlet is the 4th toy, and regrettably, while we don't always see that as a toy, sometimes young children do. So parent home safety practices are really important. Okay, next slide. Okay, so in our research, we find that parents do sort of 3 things in terms of trying to manage young children's risk of injury in the home. They do things like supervising, so they're monitoring and trying to watch closely so they can intervene quickly if needed. They teach safety rules to young children, and this seems to peak at around 3 years of age. And interestingly, by the time children are around 4 years of age, many parents use this as their main strategy of trying to keep children safe by teaching them what to do or not do in the home. And the third approach that they take, I'll call it childproofing, which of course is a misnomer because we can never childproof the home fully, but the goal is to really eliminate access to hazards. And parents often try to do that by either using safety devices like cabinet locks or moving hazards completely away and out of sight. Interestingly, once children are mobile and really able to get to different places and access different things like hazards more quickly because they are mobile, the single most effective approach that emerges in the research is supervision. So parents use these management strategies to different degrees depending on the children's age. So childproofing is something they often do for very little ones. And as they're gaining in mobility, they're moving things away, things like that. It's often replaced by teaching safety rules, and supervision is something that they do throughout the entire early years, but sometimes to varying degrees. So once they switch to safety rules, 4 and 5, a lot of times they back off on how much supervision they're doing. Okay. Okay, next. Okay, supervision is the most important and effective approach because it can do really interesting things. So here, what I'm showing you is along the horizontal or x-axis, that's how much the child as a behavioral attribute is really intense and impulsive and active. And so that's sort of an individual trait. So some children are low in this, some children are medium, and some children are high. They're going all the time. They're suddenly like, moving here, touching that, etc. So along the y-axis, up and down, we have medically attended injuries. And what we have shown is if you focus on children who are high in intense behavior, and you look at the level of supervision provided, the gray line is when there's very low supervision. And you can see with high levels of behavioral impulsivity and intensity, if supervision is low, medically attended injuries are higher. As the level of supervision increases, we go to the red line and then we go to the black line, which is high levels of supervision. As the level of supervision increases, it actually brings down the number of medically attended injuries, even though children still have this behavioral attribute of being high on intensity and impulsivity. Next slide. So supervision effectively can counteract even behavioral attributes that a child has that usually lead to more injury risks, right? And if they're supervising at a high level, you can bring down and get fewer injuries, even in these children who are really prone to doing risky things and having injuries. So you can probably understand why supervision emerges as the single most effective approach for preventing injuries to young children. Okay, next slide. Okay, so now I'm going to talk a little bit about what do we know about factors associated with parents who take fewer safety precautions in the home and consequently have children who often experience more injuries. So I'm going to go through a few factors that we know. One of the things we know relates to parenting style. So there's a variety of parenting styles. You may have heard authoritative, authoritarian, and permissive. The one that most consistently emerges as relevant for child injury is permissive parenting. And here we're talking about, you might say more lax parenting or laissez-faire parenting. Generally, they set fewer safety rules. They set fewer limits on what the child can't do. There's lots of tolerance for children trying things and learning from experience. They also focus less on safety education, so teach fewer rules about safety, for example, to preschoolers. This is what all the research shows. So studies have found more medically attended injuries among children of highly permissive mothers. And I say mothers because that's what the research has shown for now, right? So the problem with parenting style and permissive parenting is you get a combination of a few things happening. One is you see poorer supervision or lower levels of supervision, less watching and monitoring. The other is they're not doing as much teaching about safety. They want the child to sort of do more figuring it out for themselves. And these kinds of things lead to more injuries for children. Okay, next one, please. Okay. Another factor that emerges is related to how much knowledge and experience the caregiver has. So, and often these go together, right? So there's greater injury risk, for example, for children of first-time parents, usually because they have less knowledge of child development and they have less caregiving experience. They haven't raised an infant yet to realize what are the kinds of hazards that they need to pay attention to. So often they go together. So I'll go through what some of the research findings show. So limited knowledge of children's development. So we're talking about what can children do at what ages, what are motor skills, for example, at different ages. If they don't have a lot of knowledge of children's development, particularly motor development sequencing, they really can't anticipate what the next motor milestone is going to be. And unfortunately, children don't tell you, I'm going to start walking next week. They literally just get up and walk, and suddenly they're grabbing something on the table that you never removed because they never were able to reach it before. So because they don't have good knowledge of children's development, particularly motor development sequence, we see more injuries to children when parents score low in knowledge of child development. Another factor comes into whether they are able to identify hazards that could cause injury. Because you first have to notice something before you can act on it, right? So if a parent doesn't identify that lamp cord is actually a hazard, my child could pull on it, the lamp might hit him in the head, then they don't know to remove the hazard. Okay, so awareness of hazards and the ways children do risky things with things unexpectedly is a precursor to being able to remove hazards, okay, and really make the environment more safe. The last thing is that parents are not always aware of what safety precautions they might take, right? So they might not realize there actually are cabinet locks for these quirky kind of new cabinets that have been, designed in kitchens these days. So if they're not aware of what precautions they could take, closing the toilet seat, being sure the bathroom door is always closed, if they don't have an awareness, they can't really implement these, right? So all of these factors often come together, right? Because they don't have a knowledge of child development. They're not anticipating the children's future behavior. They're not considering what do I need to be doing to get ready for that next skill. And they're not realizing what a hazard is because they're not anticipating the child's next motor skill. So motor development knowledge is particularly important. Okay, next slide. Okay, I put erroneous here because I think these are erroneous beliefs because I believe in the preventability of injuries. So some of the beliefs that parents have about injuries get in the way or are barriers to taking action. So one is a belief, if parents believe that injuries are not preventable, if they attribute them to bad luck, that's what happened, then of course they're not going to work to prevent these, because if you can't know something is preventable, then you're not going to take actions. A lot of times parents say, oh, injuries are just part of childhood. Like, I'm just assuming we're going to wind up in the emergency room at least 3 or 4 times when they're getting through the child early years, right? And if they believe that, then again, they're not going to implement precautions or believe that they can take actions to reduce the risk. We have found that fall prevention in particular is a real challenge, partly because it is true, all children fall. But on the other hand, falling from heights, for example, can be very serious, right? So parents who attribute falls to just they're not going to be serious. They're always tripping over their own feet. That's just part of childhood and toddlerhood. Those parents don't consider the potential severity of a fall, what could happen if they fell off the couch and the table was right there. And so these kinds of beliefs lead to more injuries in children. The last thing I'll talk about is some parents believe there are benefits to children getting injured. And maybe that's because they assume they're not going to be severe and that they're not going to be preventable. And so they say, okay, well, they'll learn not to do that if they fall a few times and it hurts. But they don't realize that, unfortunately, without a crystal ball, we don't know if the fall from the height off the couch is going to be minor or if it's going to be severe. And so if parents believe in the benefits of injuries, we really need to first convince them of the likely severity, the likelihood of it happening, the preventability of it. So there's many more things you have to get to before you can persuade them that there probably aren't very many benefits of injuries. And one of the interesting, epidemiology findings I always remember was that the single best predictor of a medically attended injury in a child is that they previously had a medically attended injury. And so sometimes letting parents know that surprising fact is enough to convince them that, well, maybe there aren't really benefits. Maybe children actually don't learn risk avoidance from getting hurt. So these beliefs are all things that can get in the way of parents implementing safety practices at home. Okay, next slide. Okay. Erroneous, again, my view, beliefs about young children can come into play. So lots of times, by the age of 3, parents are spending a lot of time teaching safety rules. Smart little beings are able to recite these back, maybe by the age of 4, 4.5, 5. So parents think they know the rules, but they don't appreciate that reciting the rules is not knowing the rule or understanding the rule. So in our research, for example, we found that preschoolers can recite only about 50% of the rules that the parents are absolutely certain the child knows. 50% at most. And they don't understand the rules. So when you ask them to explain, why can't you touch the pot? Or why shouldn't you grab the coffee cup? They don't understand. They can't really explain it. They just say, Mom doesn't want me to. So they don't understand the safety aspect of the rule. So generally, parents, we find, tend to overestimate children's knowledge about safety, particularly in the preschool years. And children might be very smart, but that doesn't mean they're going to be compliant. So that's a separate issue, right? Which leads me to the second point. Parents assume if they know the rule, they can say it, they're going to follow it. They know what I want. They know what I expect of them. And we find that's not actually true. Children are curious. I mean, these are normative things. These are positive things. They're curious about the world. They want to interact with things, see what happens when I touch this, these hazards, etc. So you cannot assume children will follow the rules. What we find, though, is if they actively supervise, even from a distance, they're watching and monitoring, and the child knows that, that promotes compliance. And there is a fair amount of research showing that children, even during middle childhood, if they know they're being watched, they tend to reduce their risk taking. So little ones do that too. The last point here is that a lot of times parents think an older sibling will keep a younger sibling safe because the older sibling knows the rules really well, and they may even understand the rules. But that we find does not hold true, that an older sibling can keep a younger one safe. And that's for a few different reasons that we get to sort of negative outcomes here. One is sometimes the older child is modeling risk taking. Now, keep in mind an older child who's 7 or 8 might be able to do all kinds of things that are not an injury risk for them, right? But could be if you have a 3 or a 4 or a 5-year-old trying to imitate. So they're modeling risk taking and they're not closely monitoring, not like a parent would, is our second point. And that those two things can lead to a lot of injury risks for younger siblings. So that's all if the older sibling is not as great a supervisor as we had hoped, right? But you also get this interesting phenomenon where they might be great. They might be great supervisors and giving lots of feedback and not modeling risk taking. But we also see sometimes the younger sibling just won't listen to an older sibling. They'll listen to a parent say the exact same things, but not an older sibling. So you can get this interesting, elevation of risk with sibling supervisors that sometimes is attributable to this older sibling supervisor, but sometimes is attributable to the younger supervisee. And sometimes they come together, and then it's really problematic. Okay, next slide. Okay, so obviously prevention is the only cure. And for home injuries, we're really targeting caregivers to try and get them to implement more safety and precautionary strategies. So I'm going to talk now about some of the research-based, these are evidence-based strategies that have been shown to encourage, promote behavior change and parents implementing more safety practices. Okay, next slide. Okay. So the first thing I'll talk about are injury statistics. Now, in and of themselves, this might not be enough to promote a behavior change, but it certainly might promote attention to an issue that parents assumed were like not an issue, right? So injury statistics communicates the scope of the issue, which tends to get parents' attention. Most parents are shocked when they come into our lab and we say, we do this work because unintentional injuries are actually the leading cause of preventable deaths for children in Canada. And they look at me like I have two heads, like, that's not possible. It's not like cancer. It's not. some other thing? Like how is it something like this, which is preventable most of the time? So sometimes injury statistics is enough to get their attention, which then you can increase their knowledge or, give them some strategies, things like that. Local statistics may help also with parents feeling it's closer to home than I realized. So, if leading cause of child ER visits in your local hospital is related to falls last year for children under the age of 6, that might be something that gets your local parents' attention, right? So it could even evoke like a community-based commitment to prevention. Let's change that statistic. Let's try some different things. Here's some knowledge. Here's some strategies. So injury statistics, not in and of themselves, might promote change in behavior, but it can also often create readiness for listening to more information about the topic. Okay, next slide. Okay. Injury stories or emotional testimonials can be very impactful. They're very effective to recruit attention and encourage behavior change. We try and focus on more common behaviors that most children do, so the parents can't ignore the story and say, oh, well, we don't have a pool, so it doesn't apply to me, or my child would never do that, so it doesn't apply to us. We try and pick really typical kinds of behaviors that went badly wrong and the child got hurt. An injury story really refutes all of those beliefs that get in the way of parents taking action. So the child got hurt doing a typical kind of thing that went badly. That's injury vulnerability. They're vulnerable. There's that belief. The outcome was very severe. Well, there's that belief that it won't be a severe outcome. Parents could do more. That comes through in the testimonial, right? So it gets them thinking. Having a parent listen to the story is more impactful than having them read it. Because one of the things about testimonials that are like stated is there's emotionality that can come through. And that really gets to parents and gets their attention and gets their memory for the story. We also find that emphasizing long-term negative effects evokes greater readiness or willingness to change. So when we talk about falls, and yes, they might be minor, but you know what? There's research showing that lots of minor concussions in the early years when the brain is developing actually can affect long-term learning. That kind of information gets a parent's attention and they sit right up. Wow, I didn't realize these small little bumps might have accumulative negative effects on learning. I want my child to be smart. I want them to succeed. So now we have their attention to at least consider what might they do differently. Okay, I'm going to give you 2 examples of testimonials that appear in a program, which I'll talk about shortly. Okay, next slide. The first one. Okay. Never did I think this could happen. Sam was my baby, only 4 years old. That day, I left Sam alone for just a minute to help my husband in another room. By the time I got back, Sam was laying on the kitchen floor. He must have tried climbing up on the chair to get the cookies I left on the counter. We dialed 911, but by the time they arrived, it was too late. I never should have left for that long. I know in my heart I was gone longer than a minute. Things never take just 1 minute. It can be said in a very impactful way. And the just 1 minute refrain we use later in a program, which I'll tell you about. Okay, let's try one more. Next slide, please. Okay, great. I remember that day very clearly. Even though I had a terrible headache, I took a pain reliever and I put the pills in my purse on the table. I lay down for just 1 second. I was so tired and in a lot of pain. Never did I think that Casey would go into my purse and find a way to open the pill container. Thinking back, Casey probably thought the pills were candy. They're the same color and shape. The child was just curious. How could I have not realized Casey was already capable of doing this? I closed my eyes to rest for just 1 minute. Okay, so testimonials, as I said, they can be very impactful because there's the emotional piece. We try and, sometimes build in, this parent tried to do a good thing. She closed the pill container, she put it in her purse. Who would know that Casey would be able to do this, right? For names, we always try and use children's names that could be a boy or a girl, like Sam, boy or girl, Casey, boy or girl. So any parent could potentially relate to what the child is doing. Okay, so sample testimonials can be impactful. Okay, next. Okay. A third way you can implement, use a strategy to promote parents doing more safety things or showing negative consequences of children engaging in a risk behavior. So we're talking about injury consequences. You can see in the picture here, there's been an injury, the child is crying. It's not just the risk behavior we want to show, look what happens, look what the consequences are. Years ago, I was trying to do a fall prevention intervention, and I was trying to work with the hospital for sick kids. And I'll never forget this because I showed them some of the materials I wanted to use, and they said, "Oh, we only do happy babies." I was like, okay, so happy babies are not like injured babies. So anyway, needless to say, I couldn't work with the organization. But if you're trying to work with an organization, just be sure and check to see if they have any marketing restrictions on the kinds of images you might show, or if you can use testimonials or not. Like there's different policies in different places. So just be sure you do all that before you try and develop a lot of materials that might not be used. Showing consequences tells a story. We get from the risk behavior to a negative outcome. Those things are associated. That is a nice story for parents to understand. The negative consequences also evoke parents' appraisal of danger. Clearly, if this led to crying and injury, this is dangerous. So they do a reappraisal of danger sometimes, depending on what you show, right? And that creates readiness because I don't want that to be my child with an injury, crying and upset. I can make better choices, different choices. So it creates more readiness to address the danger and avoid that outcome for their children. I'll show you a few images now. Next slide, please. Okay, so this is one, it's a cartoon depiction. It was from the A Million Messages originally, and we modified it to add a consequence or near consequence, right? So that's the story. Child's alone in the tub, and look what's happening. Okay, the next slide, please. Great. These are a series of posters that we developed as part of a fall prevention initiative in our community. So falls can cause serious injury. We start with the child at the top of the stairs. Clearly, they're alone, and we get sort of an arm broken and child very upset, right? So falls in the home are a leading cause of ER visits in children under 5 years old. So we add the statistic as well, right? For a new approach, go here for a strategy. Okay, the next one. Okay, this is a very common behavior, right? Children, this is a 4, 5, 6-year-old. They think they can just, I'll just climb up and get it. I won't go ask mom for it, right, or dad for it. So falls can cause serious head injury. It also has damage to her face, right? So like sometimes facial injuries as well as head injuries because the facial are so visible. Parents get very distressed about these. I don't want that to happen, right? So again, falls from furniture are a leading cause of ER visits in children under 5 years of age. So our local injury statistics told us that falls from furniture was a big issue. So we focus on that in particular. Okay, next slide. Thank you. Oh, my kid just loves having fun jumping on the bed. Okay, falls from furniture, though, are a leading cause of ER visits in children under the age of 5. Look what happened to Casey here, right? Again, we have a facial injury, we have a head injury. Okay, and the next one, please. Okay, jumping on the couch was the other biggie, right? We have the cape, I'm Superman jumping on the couch, whatever. Yes, and you can get serious neck injuries, right? Because you can see that little table is right there by the couch. Right? So again, we're reinforcing, here's the statistic, here's the image, here's the problem that occurs. So images that show consequences can be very effective. Okay. Okay. Next slide. Thank you. Okay, so the fourth way that you might motivate parents to use more safety strategy is a program that we developed called the Supervising for Home Safety Program. which I'll tell you a little bit about. And all of the materials are online and available. I'll give you the website when I get a little further along. So Supervising for Home Safety program, it's an evidence-based program developed based on all the research I just presented about images and beliefs about injuries and beliefs about children. And we took all of that and we created this program to really address all of those false beliefs, hopefully communicate different strategies and ideas of ways parents might manage. We used gold standard research designs, which is randomized controlled trials, to evaluate the effectiveness of the program. We found it increased supervision at home among parents 5 and under, and the effects persisted for at least a year. We ran out of money after a year, but we know that at least for a year later, these parents who got the program were much closer in supervising and monitoring their children. And it is, to our knowledge, the only proven program to increase supervision behaviors. And remember, supervision is the single most effective strategy to prevent injuries for kids, young kids in the home. Okay, next slide. Thank you. So there's two parts to the program. The first part is it only takes a minute video, right? So now those testimonials where they emphasize it only takes a minute, or I wasn't really gone a minute. Now that probably makes more sense to you. The video is called It Only Takes a Minute. And it basically targets all the key psychological factors, the beliefs I just talked about. So it uses injury stories, it uses statistics, it shows injury consequences, etc. And all of that creates readiness for behavior change. The second part, you have a lot more flexibility for the second part. So there's 1-minute video vignettes, which I will show some samples of. And the vignettes are shown really to make risk come alive for parents. Like, oh yeah, my kid does that. And then alter is introduced. This is your tool for how you can manage injury risk in your home. And I'll explain that in a minute. Okay, next slide, please. Okay, so It Only Takes a Minute video, it takes about 13 to 15 minutes, somewhere around there. And basically, it is a very emotionally driven video. So it moves from fear, like what happens, the injury statistics, the consequences, to hope. Yes, but kids are curious and you want that curiosity, and we just have to manage that curiosity in an effective way to, yes, I can do more. I could probably do just a little bit more, something a little different than what I'm doing, right? Because that's the idea. We want to get to agency. We want to get to readiness for behavior change. And then, we give them the strategy, the alter strategy. It challenges all those beliefs. Children are vulnerable for injury. We show that. We show the statistics. It covers each different type of injury with statistics and images and consequences and stories. It shows long-term effects of injuries, which we know is impactful for parents. They pay more attention, and their self-efficacy, the ability to do a little bit more, do things a little bit differently, that comes through in the video. So this, It Only Takes a Minute video, it's available online. Okay, next slide, please. Great. Part 2 is the one where you have a lot of control over part 2, making it be whatever you need it to be for your parent groups or your parents. We use video vignettes, and so there's video vignettes for each of these injury topics. There's drowning vignettes, burns, falls, poisoning, choking, and I'm doing research in the US, and we had to add gun safety, sad as that is. So we have a whole gun safety library now. There's a whole video library, basically, and you choose, depending on what injury topic you want, what is most relevant to your group or your parent. There's videos that cover sibling supervision issues. So they demonstrate that and raise some challenging questions for parents to think about. And there's videos that really try, how do you balance independence and promoting independence, which of course we do. We're not raising children in a bubble. That's not the goal. But how do you balance that with safety, right? So as they're learning to go up the stairs, maybe you're walking behind them for the first while. Or when they're learning to go down the stairs, you're in front of them for the first while. So the point is you can promote independence and teach how to do things safely, right? Does that. So there's videos that communicate that. If you've got one of those really challenging groups of, I'm not raising my kid in a bubble. Okay, we've got video vignettes to persuade you that that's not what we're advocating for. There's also videos, they show different ethnic groups. There's moms, there's dads, there's moms and dads. And these are real life home situations. We did not like, video record these in some, elaborate model homes. We went into the community, into parents' homes, messy homes, livable homes. That's what we wanted and show in the videos. So, definitely later, if you're interested, go online, you can access all of it. Okay, next slide, please. Thank you. And finally, I introduce Alter. Alter is a mnemonic and parents love it. It's very easy to remember. And we basically say, okay, use Alter to reduce your child's risk of injury in the home. You get to choose, you decide what works best for you. So A means change the activity of what you're doing or what your child is doing, right? So you may have your child help you pull out all the socks from the basket, right? And bring them to me, right? So we change the child's activity while I'm busy doing something, I involve them. We might change the location of the parent or the child, right? So bring the child to the kitchen with their favorite book to sit in the corner while I'm doing the dishes. So I can watch them, they can read to me, right? So changing location is a way to just manage risk. Because we know when kids know we're watching, they do less risky things, right? Timing of a parent's task has changed. So we ask parents, like, really think about how much attention it's going to take you to clear out a closet or straighten a drawer. Like maybe if it's going to take a lot of your attention, a lot of your focused attention, maybe you want to do that when your child's sleeping, right? Things like that. So just time things, make decisions about timing of when you're doing things. The environment might be changed to reduce risk. So, we always say attach bookcases to the wall. Well, a lot of the families we work with, they're renting. We can't attach bookcases to the wall. So we say, okay, so what creative solutions might you come up with? And one of our parents came up with a wonderful creative solution. She actually put bells in front of the bookcase. So if she was not in the room when the child approached the bookcase crawling, they would hit the bells and she would come running. And it worked like a charm. It wasn't something I would like put in an ad to sell, but it worked for her in her environment. And it prevented injuries, right? And that's what we want. We want them to be creative, come up with solutions that work for you in your home, and use your resources, right? Like maybe you can get help from another person. Can you take my child Thursday and I want to clean the house and I'll take your child next Thursday? Or you want to know if something's poisonous. Is this cleaner okay? It says environmentally friendly. Can I spray it where my child plays? Go online. Maybe there's information. So there's all these strategies. We basically say, pick a few, try them, see what works for you. Different strategies might work for different children, might work in different situations. There isn't any you should, there isn't any you must, there isn't any never, there isn't any always. We don't use any of that kind of language because parents get turned off by it. So we really try and collaborate with them. We're on your side. We get it. Safety is hard. You have so many things you're doing. And great that you're willing to try a few different things. So here's Alter. See if it helps you. Okay, next slide. Okay, so I want to now show you a few sample videos. Okay, go ahead.
Girls, cake time. Cake's ready. Who wants a pee? Me. Hang on, someone's at the door.
Okay, the mother pushes the plate out of the child's reach. Very smart mom.
Don't touch anything.
Don't touch anything. She's anticipating, but the child's ignoring the request not to touch. Cake is very, very important.
No, it's not like that.
Younger girl is imitating the older sib who got cake as her reinforcement. So she's going to try it. So what could the mother have done differently and how could Alter help? So when we show these vignettes, after each question comes up, we stop it and we have a discussion because we want to know what they're thinking. We want to know where they're at. And do they understand different things? We want them to appreciate the perspective of the child. We're not saying that child is bad for not listening to the mother who specifically said, don't touch anything before she leaves. Good on her. She anticipated this might happen, right? It's not the child is bad. The child wants cake. They're a typical kid. Hey, I can see it. I want it. I can reach it. I'm going to go for it. So we're never like blaming or shaming. We're always trying to create the perspective of the child, support the perspective of the parent, and suggest what could the mom have done differently? How could Alter help, right? We're collaborating. How could Alter help? Okay, let's try another one.
bubbles. Who likes bubbles? Oh, somebody's gone. Let's see.
I want the blue one, Mama.
Hello?
Mom brought the phone with her. Smart mom, right? She was anticipating.
Hi, John. Oh, yeah, I can give you that phone number. Just 1 second, okay? I'll be right back.
What is she expecting is going to happen? Can the older child keep the younger child safe? Probably not in the tub. Why or why not, right? Where my parents tell me why not, right? And what could the mother have done differently? How could Alter help? So again, we stop it, we talk about it, we get the perspectives. And parents will disagree with each other, and that's great, right? Because we want the full range of what your thoughts are, how can we moderate in the middle? That's what's important, right? And how could Alter help? Maybe 3 parents would use Alter in totally different ways in this situation, and that's okay. Okay, the last one.
Hello.
Hey,
How's it going? Good. Hi.
Stella, did you have something to tell Mommy?
I like that.
Oh, you know what? I picked it up outside. It's in my purse. I'm just going to run to the bathroom, and I'll come back and help you.
So she found the little girl's doll. It's in her purse. And she's thinking, I'm going to get the doll. That's all she's going to do. What is the child thinking? Wow, look at these treasures. Mom gave me her purse. And what might happen next? There might be some negative outcomes. Right? The child put coins in their mouth. What could the parents have done differently? How could Alter help? We would probably talk about, why is the child doing this? She's little. Maybe she never gets the purse. Maybe the mom's done a great job of keeping the coins away from her. And now she's like, oh, wow, gold mine. I can actually access the coins. I've always wanted to do this. So you just, children are being children. They're being curious. So how could Alter help? That's what we're interested in. Okay, next slide, please. Thank you so much for operating those videos and so successfully too. I really appreciate it. Okay, some points about the program. Why do we use videos? We did a ton of research, and ultimately we came back to videos. Parents kept saying videos. And we realized that one of the things that's really important about videos is you can not only manipulate the content, but the emotional tone. And emotional tone sometimes has much more impact than content on getting a parent's attention or their memory for something in particular. Emotions, really tagged for memory. And so that's what we use in all of the program, is based on videos. Why show text and audio? So when you look at the It Only Takes a Minute video, you'll see as things are being said, we show the text. And we do that because it fits any learning style. Some people are very visual learners, and seeing it really makes their brain encode the messaging in a different way. Some people are auditory learners, and I just need to hear it. I don't need to see it. So we wanted to cover all our bases, and that's why we do it. And parents say it works great. So everything was tested with parents, just so you know. And what parents especially like about the program: we're not telling them what to do. They choose their strategy. Here's Alter, try different things, see what works for you, your child, etc. There's lots of options, which fits with other values. So the problem with telling parents, like, attach things to the wall or things like that, is, move all your hazards. Some parents have a value that says, I want to live and enjoy my environment too. And seeing the vase out brings me pleasure. So I don't want to have to put it away. I want to be able to have my child coexist with that hazard, quote unquote, in the room. So, okay, how do we do that? We have to supervise then, right? If we're not going to remove, we must supervise. So it gives them options to choose from. If they have values that suggest, no, I'm not going to do that, even though a lot of people tell me I should. It's easy to remember Alter. And a lot of parents go home and they tell us, I'm using it with my 8-year-old now, and it's working like a charm. So it's broadly applicable, just so you know. Okay, next slide, please. Okay. How has the program been disseminated? So we have randomized controlled trials. We did parenting groups through the Ontario Early Years Centers, and it increased supervision, readiness for change, really shifted beliefs about injuries in children. So lots of very positive outcomes. And we did it home visiting one-on-one as well, which sometimes is very applicable for like a high-risk group. And we, again, with randomized controlled trials, get very positive results, lasted over a year. We're currently, some of my very smart and ambitious students are testing an online delivery format. We've been piloting it, and I think we're getting closer now to really running groups and really trying to see if we can get similar kinds of positive effects. Online delivery, of course, would be extremely cost effective and really open it up to everyone who, has barriers that prevent them getting to a community group like Ontario Early Years or us coming into their home. Some people don't want us in their home, and I get that, right? So we can bring it to their home without going there. So an online version is something we're really committed to getting to work, and we're working on it. So, okay, next slide. Okay, some considerations, just to wrap up with some considerations. Next. When we target parents with our intervention messages may also matter. So people talk about teachable moments, right? So this is like a naturally occurring, like an almost health event, if you will, a negative event, or an actual negative health event that suddenly opens up your mind to like, okay, I need to do something differently than what I've been doing, right? So after the child has experienced an injury that results in some treatment being required, that may be a time when parents are really open. There's a readiness window, if you will, perhaps. They're really open to trying different things, thinking that injuries are preventable, taking some different action. So maybe in an emergency department or in a doctor's office, those might be very opportune moments. So, and the next slide. Thank you. There are gender differences that are operating after 2 years. We know from the injury statistics from about 2 years on, boys have more frequent injuries than girls, and they tend to have more severe injuries than girls. And, you spend an hour or two at the playground and you see that, girls are, sitting nicely on the swing or leaning over and nicely swinging, and boys are like tossing the swing around the pole. They're just different beings, and that's okay, right? But it means that, sometimes it requires greater effort to keep young boys safe. So in the research we've done, we've shown that boys are more wanting and curious to explore hazards and do risky things with them than the girls. Girls are more cautious. They stand back, they look, which gives parents lots of time to intervene. If your child is waiting and looking and you catch that, you can intervene. If your child is really fast, like boys tend to be, they're immediately going and touching something. You really don't have a lot of time to intervene, right? You're dealing with the problem. So they tend to also be non-compliant with verbal redirection. So we've done research where parents are trying really hard, like, stop, don't continue, don't go to touch that. And boom, they're going anyway. So they're not as compliant as girls are. And often they literally need to be physically moved away from the hazards or the hazard moved away from them. They really need to be more closely monitored. They tend to be more persistent. And the monitoring helps reduce the risk taking, right? So, I mean, this is what the research shows, like it or not. And of course, broad brushstrokes here. I'm not saying all boys are like this and all girls are not, or vice versa, right? Like there's a gradation of, distribution here. But I'm just saying generally what we see is boys have more frequent injuries, more severe injuries, and this kind of, need to be more vigilant probably contributes to explain it. Parents are not like super people, they can't be everywhere all the time. Okay, next slide. Okay, I always wrap up with this one because active supervision does not have to mean kids are being raised in a bubble. There's a great little cartoon, and if you can't see, what he's saying is, it doesn't look safe to me at all because his face is totally exposed to danger. And, that's my ha-ha, because we're not saying we should be raising kids in a bubble, but that doesn't mean we don't manage risk. That doesn't mean we don't try and anticipate what the children are going to be doing next, or what our child, given their personality, that's a consideration, given their behavioral tendency, their personality, their curiosity, all these things come into play. So parents are the experts on their children, and we really try and reinforce that idea, but also take some agency, use Alter, see if you can have some impact, right? You don't want to spend your time in the emergency department. Okay, next slide. Okay, so here's my email. If you're interested in the Supervising the Home Safety Program, I should put the website here, apologies, but it's basically alterforchildsafety.ca. That's the website. And you can register. And once you register, because I'm trying to track who accesses the information, you can access everything, download it. Feel free to email me if you want to try and use the program and have questions or challenges. We're always also adding new vignettes to the situation. So if there's a vignette that's particularly important for your community, be in touch with me because maybe we can add that vignette. We're in the process of adding vignettes related to living in, cities, right, where there's elevators, for example, there's parking lots, there's balconies, things like that. So we are adding those vignettes now too, to broaden our applicability of the Alter program. So alterforchildsafety.ca. And please feel free to be in touch with me. I'm always interested in collaborating with community organizations. Oh, there you go. Thank you, Caroline. There's in the chat box is the website. So, any questions?
Thank you so much. While we wait for some questions to roll in, I'm just going to switch the slides here and just give folks a chance to scan the QR code if you're interested in our community of practice, the link. But Drew, you let us know if any questions roll in.
Yeah, I will. So far, I don't see any questions. Okay. Sandra
No?
is saying, thank you so much. And she's very pleased to see the videos. And this will be very helpful and useful.
Great.
And Cynthia says, thank you so much for the great presentation.
Great. Thank you for
Wonderful.
attending. I appreciate it.
Great. Thank you so much for attending this presentation. We would like to remind you that a recording will be on our website and also our community of practice if you scan this QR code. It is an opportunity for open communication, discussion around issues related to children's injury prevention, and we are also sharing other webinars and opportunities and such on there. So it's a great place to go if you're interested in some of these topics.
Thank you.
Thank you so much.
Bye.
Thanks so much.